Today's class is brought to you by Colorado Medicare Classroom.com because you can't afford to fail this class. Hi, I'm George and I'll be your instructor today. Today's class is Medicare 101. It's going to be a very basic class. We're just going to cover the four parts of Medicare. Part A, which is your hospital insurance. Part B, which is your medical insurance. Part C, which is the Medicare Advantage program. And finally Part D, which is prescription drugs. I will be doing another class in which I'll go into a little bit more detail about each one of the four parts of Medicare, but I just wanted to make sure that you understood how the four parts work and how they work together. So with Part A of Medicare, again, that's your hospital insurance. And when you first go into the hospital, Medicare pays in 2015 all but the first $1,260. Now, once you've been in the hospital 60 days, which is really a moot point because nobody ever stays in the hospital that long anymore, Medicare goes into a daily copay that you probably need to be aware of, but in 30 plus years in this business, I've only had a couple of clients that were ever in the hospital that long. Medicare Part B is your medical insurance. Now, under your medical insurance, you have an annual deductible. In 2015, that deductible is $147. Once you meet that deductible, Medicare pays 80% of the portion of your bill that they approve. They're not paying 80% of your whole bill, they're paying 80% of the approved amount. Real easy example, if you have a $100 doctor bill, Medicare approves $80, they're going to pay 80% of the $80 or $64. You're responsible for the other 20% of the approved amount, and if your doctor doesn't accept Medicare's assignment, again I'll explain that a little bit more in detail in the next classes, you might have to pay some of what's called the excess charges. Also, Medicare Part A, they say it's free because you're entitled to it. Well, if you paid FICA over the years, it's really not free, you've just prepaid it. Medicare Part B, however, is a voluntary program. You don't have to accept it, although in most cases I recommend that you do take it. If your income is less than $85,000 in 2015, or your combined family income is less than $170,000, your Medicare Part B premium is only $104.50 a month. Part C is the Medicare Advantage program. The Medicare Advantage program can be a little bit more complicated than traditional Medicare. So I'm going to go into a lot more detail on it in another video, but basically you still have Medicare Parts A and B. You're not leaving the Medicare program, you don't get to quit paying your Medicare Part B premium, but the Medicare Advantage is in simplest terms a privatization of the Medicare program. Part D is the Medicare Prescription Drug Program. The Prescription Drug Program was actually passed in the 2003 Medicare Modernization Act. It took effect in 2006. When you're in the Prescription Drug Program, some plans have a small deductible, which a lot of them will waive if you're receiving Tier 1 or Tier 2 drugs. Once you get to what's called the donut hole or the coverage gap, and I'm going to go into more detail on that in a later video, you will pay a much higher percentage of the cost for your prescriptions for your generic and your brand names until you come out of the donut hole or the gap and you go into what's called catastrophic coverage. So that pretty much sums up the Medicare program, the four parts of Medicare. As I mentioned in a future video, I'm going to go into a lot more detail. But for today, that's Medicare 101. Class dismissed.